Welcome back to Bread and Butter Primary Care. I'm Dr. Stokes, and we're continuing on with our unit as far as the mental health unit on depression and anxiety, and going to talk about a couple of the medications that don't quite fit into the standard SSRI class. So this video is entitled Wellbutrin and Remeron, How Do They Fit In? And so we talked in the initial video on SSRIs about the serotonin reuptake inhibitors and kind of why to choose one or the other, how they work, how to follow up. There's a couple medications that are kind of in a class of their own, that they don't really fit exactly in some of the other groupings, and they kind of fit into the treatment of both depression, anxiety, and even sometimes ADHD in a little bit different way. And so I wanted to do a completely separate video on those particular medicines. So two come to mind that are they're just different in several important ways. So one is Wellbutrin or bupropion. So this is a medication that is used for depression. It's also used to help people quit smoking, and it's also indicated for use for attention deficit disorder. And there's a few reasons why you may reach for Wellbutrin rather than one of the other medications, or maybe as an add-on, or if something's not working. It has several distinct advantages. And so one of the advantages of Wellbutrin is it is one of the only antidepressant medications that does not have, or at least has much less of problems with sexual side effects. So one of the more common sexual side effects with serotonin medications in the treatment of depression and anxiety is problems with decreased libido or desire for sex, as well as sometimes difficulty with erections in men. And a lot of people take these medicines and don't seem to have any problem with it. Some people have very significant problems with it. And for different patients, it's much bigger deal than others. So some people are like, well, yeah, it did kind of cause some sexual dysfunction, but that's not really all that important to me. Other people, it's very, very important, and they'll come back a month later after starting and saying, hey, I've even had patients say this works really well, I feel really good, my mood is really good, but I can't take it because it's interfering with my marriage, it's interfering with my relationships, and I need something different. And so in those cases, that's one reason why Wellbutrin is sometimes a preferred medication, is because it does not have nearly the problems with sexual side effects and sexual dysfunction as some of the other antidepressant medications do. And it also is one of the only antidepressants, at least in the initial classes, that is not associated in any way with weight gain, and if anything is weight neutral to weight negative. Bupropion is actually one of the ingredients in some of the newer weight loss medications. So there's a medication that's a combination of Wellbutrin and naltrexone that is approved and indicated specifically for weight loss. And so if people are concerned about a lot of weight gain on their antidepressant medications, or if they're concerned about sexual side effects, then Wellbutrin can sometimes be a very positive medication for those patients. The downsides with Wellbutrin is it's very activating, more activating than some of the others, and so sometimes if there's a lot of anxiety to someone's symptomatology, then Wellbutrin can sometimes be activating and stimulating, and can sometimes make anxiety worse. So I have had patients come back and say, this makes me jittery and irritable and anxious. And so that's one thing to watch out for. And now it also has that kind of side indication for ADHD. The reason why isn't completely well understood, but it seems to be the fact that Wellbutrin has some stimulant properties, and that probably contributes both to its benefit in ADHD, its benefit in smoking cessation, and its benefit with weight loss, because it doesn't have anything to do with nicotine blocking. It doesn't have anything to do with appetite suppression. It just seems that people who are on bupropion or Wellbutrin tend to be more successful at achieving their goals. And so if you're trying to quit smoking, if you're trying to lose weight, then this seems to be helpful. And it's probably due to that increase in attention. That's why it helps with that as well. It just enables the mind to focus, to be goal-oriented, and to achieve what someone's working on. And so it's a very good medication. I use it a lot. Like I said, the only hesitation I have is in patients who are really anxious as to whether or not it'll be a good choice. So it's something to keep in mind for patients with any of those characteristics. The other antidepressant medication that has some interesting kind of indications and side effects is Remeron or mirtazapine. So unlike the SSRIs, which are serotonin reuptake inhibitors, so they stop the nerves from taking up the serotonin after it's been released, Remeron tends to just increase the release of serotonin. So in either case, it's a serotonin increase, but by different mechanisms. So Remeron can be a very good medication. Mirtazapine is the generic of that. For addition, so if someone's on an SSRI and it's working, but it's not strong enough, but you're already at a high dose, then that can be something that you can do. And then it has a few different side effects that in a lot of cases make it undesirable as a choice, but in some cases actually make it very desirable. And the two in particular for mirtazapine are increase in appetite, and it's also very helpful for sleep. And so weight gain is an issue with some of the antidepressant medications, and in particular with Remeron, that's true. And so there's a lot of people who would want to avoid this medication simply because they don't want to have a lot of weight gain with their treatment. Now, there's a significant population of people, however, who actually need weight gain and want that. And so oftentimes, if I have older patients or even patients who one of the things they struggle with their mood is lack of appetite. So sometimes I'll have people say, I don't eat well, I never feel like eating, I get really sick if I eat anything, they're really low weight, they've been losing weight. Older patients who aren't eating well, who don't have an appetite, and partly due to their depression, Remeron can be a very good choice because it actually will increase appetite and help assist with weight gain. And it also is very helpful for sleep. And so oftentimes when I'm taking a history on a patient's depressive symptoms, I always ask about sleep. How are you sleeping? How's that going? And I usually ask about appetite. Tell me about your appetite and how you feel about your eating. And in cases where they say, I don't have an appetite, I don't feel like eating, I don't like food, and they're not concerned about weight gain, Remeron can actually be a very good choice. So it can be very good to add on to other medications if you need kind of a little boost, and it's very good to help people who are having trouble sleeping and who are having trouble with appetite. And so anyway, those are two medications that don't quite fit into the SSRI group, but they're kind of very similar, and they have those kind of extra indications. So patients who need help with attention, need help with weight loss, need help quitting smoking, Wellbutrin is a good choice for those patients. It also has less problems with the sexual side effects. So any patient who's coming in with that complaint, a switch to Wellbutrin is oftentimes a good idea. And then Remeron, any patients who are having trouble eating and trouble sleeping and aren't concerned about any weight gain, but it would actually be a good thing for them, then Remeron is also a very good medicine to turn to. And so there's just kind of two options to help broaden your treatment options when evaluating and treating patients with these types of conditions.